health. What does good health mean anyways? What does it mean to every single one of us? I invite you all to think about that and maybe revisit your thoughts at the end of this talk and see if anything has changed for you. In preparation for this talk, Cathy and I asked a bunch of people what good health meant to all of them. And we really heard everything from, I just want to be sick, to I want to be injury-free so I can run a marathon, to I really just want to have peace of mind. So clearly, there's a wide range of feelings and emotions behind good health, behind what people think good health is. And this is really well embodied in a definition of health which dates to 1948, and it's by the World Health Organization. And they said that health is a complete state of physical, social, and mental well-being, not merely the absence of disease or infirmity. I really love that. And to me, it means living healthy, living without disease or injury, but with quality. Yet, when we all think about the times when we've gotten sick before, maybe the response wasn't quite so. We think about having to book an appointment, having to go to the doctor, having to fill a prescription, having to get more treatment. It's really reactive and it can be one-dimensional. So we've gotten really, really good at treating the disease, but are we good at treating what's around it? So for all of the amazing things we get out of healthcare, maybe there is still a little gap between what all of us want and what we're getting out of healthcare.
So let's take cancer as an example. We all know the amazing advancements that we made in cancer care. So therapies are becoming more targeted, survival rates are lasting longer, and people are living longer than ever before. However, for many patients, what happens around cancer, the silent side effects often go unnoticed and untreated. So tonight, I'm going to talk about 4 side effects of cancer. Number 1 is hair loss. It's the most recognizable side effect of cancer. And we've all done it. We've all been in the supermarket and we see someone without any hair and we wonder, does that person have cancer? Cancer not only strips away hair, but strips away choice for patients. Strips away the choice to keep the diagnosis private. The choice to who to tell and when. The choice to look in the mirror and see your own reflection. Number 2 is peripheral neuropathy. This is a silent nerve damage caused by cancer treatment. And feeling goes in the hands and feet of patients. And 2 out of 3 patients get this, and it's really painful, and often it never goes away. And it has a huge impact in the daily lives of patients. So simple things like sending a text message, typing that email to a work colleague, going for that run, kicking a ball outside. Simple daily activities of life start to disappear. Other things like milking the cows or tying the shoelaces of a child or playing the piano, again, silently erode from daily life. Number 3 is time. Hours and hours of patient time are caught up in the logistics and the hassle of getting to and from appointments. Time spent driving to the hospital. Time spent in the car park looking for a car parking space. Time waiting in the waiting room. Time waiting in the infusion chair. The time spent going back home again, exhausted. 1/3 of cancer patients' time is spent waiting, not living. Surely something can be done about this. Number 4 is financial strain. Missed work, quitting jobs, bills everywhere. Medical bills, bills for medications, cost of parking and transport and fuel, it all adds up. And would you believe that nearly half of all cancer patients lose all their assets during their cancer treatment? And this is the silent cost of cancer. So yes, we have got better at treating the disease, and people are living longer, but they're living longer with these side effects. And we wonder, like, why is this? And we think towards health innovation. And we've thought about such amazing things that have come to the fore in the last 10 or 20 years. However, very often, health innovation is focused on the problems that doctors see in clinic. And cancer doesn't just live in the clinic. It lives in the days and weeks that surround these appointments, often with very stressful and very painful side effects. So when we think of healthcare innovation, not only does healthcare innovation need to treat diseases, it also needs to treat the side effects of these diseases.
So, we have painted a pretty dark picture of where cancer care is at. But really, we're here because we think we can do something better about it. And what an amazing place to be than Galway. Galway on the west coast of Ireland, an island on the west coast of Europe, where so much amazing innovation is happening in healthcare, and we are really privileged to be able to share in the experiences and the knowledge that all of these experts have to share with us. So it was exactly here that in 2018, me and 2 other people got together around this idea of treating more than just the disease and treating all of those side effects around cancer treatment. And since then, we've built a team to over 50 people, where Cathy has since joined, and so many others, all coming from different places, from different backgrounds. So Cathy is an optician by background. I trained as an engineer and then retrained to work in clinical trials. And we're surrounded by really amazing scientists and engineers and doctors and nurses and people from finances. And it allows us to look at the problem of cancer care from really different perspectives, which we think is really beneficial. And the other thing that is really quite helpful is when we ask questions. So to be able to solve all of these new problems, we have to ask the patients, what do they want? What do patients want to see change in cancer care that's going to make lives easier for all of them? So we're a team of really amazing people bound together by the one mission of delivering technologies and services that will allow patients to live better lives during cancer. And what are these technologies? Obviously, you may ask now. So the first part is really focused around the side effects like hair loss and neuropathy that Cathy was talking about. And to explain the solution, I have to explain to you why they happen. So cancer drugs, like chemotherapy, they are really good, actually, at targeting and killing cancer cells. But in the process, they also attack healthy cells like the ones in our hair or the ones in our fingers, the nerves in our fingers, and the nerves in our toes, causing all of those side effects. So we thought, can we develop something that still allows the cancer drugs to get to where they need to be, but prevent them from getting to the healthy places? And this is where we've come up with something called compression technology, which I will try to demonstrate for you if you will join me. So let's all bring out our 2 index fingers. They should be normal color, pretty perky. And then if you press them really, really hard against each other, you're only going to let go when I tell you. But when you let go, you need to look at what color it is. Okay? Let go. It really should be white. Yours was?
Yeah, mine too.
Mine was too. So what that means there is for that period when you were applying that pressure, we've managed to drive some of the blood away from the fingertips. So if we can do that, we can make sure that not as much drug gets to your fingertips, into the healthy cells, and we can make sure that we prevent those side effects from happening in the first place. So we're trying to design this technology, this compression technology, into devices like a hat or a cap that you wear that patients wear during cancer treatment, or a pair of gloves, or a pair of boots, again for patients to wear during cancer treatment to prevent the side effects from happening in the first place. That's part 1. But then you think, okay, that's great. And what about the time and the financial strain? Can you really develop technologies for that? So for this, we really have to think about what is the problem? And the problem again is that people lose a lot of time moving to the next appointment, to the next treatment. Carers have to be with their patients or with their loved ones. So we thought, okay, so if the problem is transporting all of the time, what if we can make it for patients to be able to stay home? And this is what we're trying to do. We're trying to develop technologies that allow patients to receive the same cancer treatment, but at home. Think about auto-injectors. They already exist in our lives. So if patients can receive and self-administer cancer treatment at home, they can do so in the comfort of their own favorite chair, watching their own favorite show, surrounded by their loved ones, resting. And more so, patients can stay away from the hospital where so many other sick patients are, which is even better for them. And finally, from the perspective of the person who cares for all of these patients, they now have time to dedicate to them. So we really think that this is a win-win for everyone. And at a time where all that cancer patients can think about is how much time they have, we're really hoping to give some quality time back to patients when they're receiving treatment for cancer.
So let's go right back to the beginning. Remember the question that Barbara asked. What does good health mean to you? And we're reminded by the World Health Organization quote, where good health is a complete state of physical, social, and mental well-being. And this still holds true in this day. So good health does not mean being disease-free. It means caring for patients, and it means living well. Because when you surround yourself with good people, and you have clever innovations, and you are absolutely willing to see what's right there in front of you, amazing things can happen in healthcare.
Thank you.